Okay, so I'm going to be demonstrating how to perform a catheter irrigation. So the first thing I'm going to do is I'm going to, of course, check the doctor's orders, make sure he did order an irrigation and with what, if it's normal saline, sterile water, it's what it should be. So I'll check that and make sure it is for my patient and get all that in order before I go into the room. I'm going to go ahead and get my supplies. I'm going to have the irrigation tray and the medication, or not the normal saline, the irrigation flush that I'm going to have. And so I'm going to get all that prepared. I'm probably going to grab a Chuck's pad to put underneath the patient while I do this, a basin to let it drain in if need be. So I'm going to go ahead and gather my supplies and head into the room. Knock, knock, knock. Hi, my name's Dusty. I'm going to be your student nurse today. Can I get your name and date of birth? Thank you. And do you have any allergies that I need to be aware of? No? Okay, good. I'm here today to perform a catheter irrigation. So I'm going to be taking normal saline and injecting it into your catheter that goes into your bladder. And the reason why I need to do this is because you have some clots or some sludge or some sort of material that's clogging up that catheter. So your bladder isn't going to be able to drain, and I'm sure you want to go to the bathroom. So I'm going to go ahead and get those clots and stuff dislodged and get that taken care of, okay? Do you have any questions for me? No? Okay, good. So I'm going to go ahead and perform hand hygiene and get my gloves on. And this is a sterile procedure. So I'm going to go ahead and take my irrigation tray. And I've already pre-filled this, but what I would do is I would take my normal saline and I would put it in here and be really careful to keep it sterile, pouring it in there. And then I've got some pulled up in there already.
So I come back in 10 to 15 minutes.
So now I'm going to go ahead and kink this
I'm going to go ahead and uncap my syringe
right
and
here.
put my needle on.
I'm going to be really careful not to touch
And then I'm going to want to
the plastic
get my alcohol swab
of
and I'm going to
this.
put the hub.
So I got this kinked off for now.
Especially since this is sterile urine stuff. Okay, so today I'm going to, now that we have that,
Okay, so with this, I'm going to go in, squirting out everywhere, and out.
and then I can just stick my needle in,
I'm going to go in
and then we're going to want to pull back about
and out.
2 of urine. Just so that we have enough to sample several different labs if we need to.
And out.
And then I can take that out. And whenever I
The purpose of this is just to get those clots dislodged by going in and out, you
the
know.
cap does not touch anything, so it remains sterile.
So if there is any left that needs to drain, after I take this off, I'm going to go ahead and
Recap our
kink it
needle
again.
and dispose of that in the sharps container. Then I can go ahead and put my lid
So if there's
back
anything
onto
that
the
needs to be
sterile
drained, I can stick this in that basin and drain it.
And I'm going to want to label it as the patient's name.
But if I've got it all out, then I'm just going to go ahead and hook it back up.
All of that, room number, and make sure everything is labeled accurately, and then we can drop anything on off for that.
And so I kept that sterile and everything, and so now they're good. I'm going to go ahead and tape it back to their leg. And something that I would do is if there was an amount of the irrigation that I had injected in there that I hadn't pulled back out, I would go ahead and I would document that. That way, whenever I'm recording their intake and output, on their output, I will have that. I will know that that's not part of their output. That's part of the irrigation that I performed. And so that's the end of the procedure. I'm going to take my gloves off, and I'm going to tell the patient if they have any, if they need me for anything, then I'll be back soon to check on them and to let me know. And I'm going to put the call bell in reach, and if they need anything, they can call me. Okay, so now I'm going to demonstrate how to get a sterile urine specimen from a catheter. So the first thing I'm going to do is I'm going to check the doctor's orders. You know, I see that he wants a urine specimen from this patient with a catheter. So I'm going to go ahead and get my supplies. So sometimes the catheters have a port for like a needle, and sometimes they have a needleless port. So if it's a needle, this one is a needle, you have to have a needle. So I'm going to go ahead and get my needle and my 10 milliliter syringe. I'm going to get my sterile specimen cup. I'm going to have clean gloves, so I'm going to go ahead to the patient room. So, knock knock. Hi, my name is Dusty. I'm going to be your student nurse today. Can I get your name and date of birth? Thank you. And do you have any allergies that I should be aware of? No? Are you going to need any pain or discomfort? No. Sent me to get a urine specimen from your catheter. So the purposes of this is like a culture or a urinalysis, those kinds of things. So I'm going to go ahead and do this. So I'm going to perform hand hygiene and put gloves on. I'm going to ask the patient if they have any questions, of course, and hopefully they don't. So right at this point, I'm going to go ahead and take this. I'm going to clamp it.
Run over it with
Put the bed in working position, get a call light going.
And I'm going to leave that for like 10, 15, 30 minutes before I come back, and that way I get a good urine specimen collected here. So take my gloves off, leave the room, tell them to be back in like 15, 30 minutes. And then after that I'm going to go ahead and come back, and I'm going to have all my supplies ready. I'm going to go full hand hygiene again, put new gloves on, tell the patient I'm going to go ahead and get it out. I'm going to tell them that yes, this is a needle, but I'm not going to inject it into them. It's going to go into their catheter, so it's a painless procedure. So this needle will be in a sterile little packet, of course. But so then I'm going to take this, I'm going to go ahead and clean off. And of course, I'm going to make sure first that I have enough for a specimen. So I'm going to clean this port off for like 30 seconds ideally. And then I'm going to let it dry. So then I'm going to, after it's dry, go ahead and get my specimen. I'm going to try to get 10 milliliters out of here. Okay. So now I'm going to go ahead and take this over here to this sterile specimen container. I'm going to put it in here, all 10 milliliters. I'm going to go ahead and recap my needle.
And then this stuff is just, you irrigate it.
And then I'm going to go ahead and put the lid back on.
And then until 10 minutes of that.
And so this specimen is, I'm going to go ahead and name, date, time, and all that. And I'm going to get it to the lab within 20 minutes. And so after that, I'm going to go ahead and unclamp the patient's tubing. I'm going to make sure that it's draining appropriately, make sure that it's not clogged for any reason. And then I'm going to ask the patient if they need anything, and if not, I'm going to take my gloves off, I'm going to perform hand hygiene, and I'm going to tell them that I'll be back to check on them in a little while. Okay, so now I'm going to explain how to perform a sterile urine catch, clean catch, not sterile, a clean catch. What you're going to do is you're going to talk to the patient and tell them that we need a urine specimen that is clean. So you're going to get them like alcohol swabs or some sort of antiseptic swabs, and you're going to give them this cup, and you're going to explain to them that what we need them to do is we need to take the antiseptic and you go to the bathroom, take the antiseptic swabs and like clean. For a female patient, they're going to clean each side of the labia and then in the middle with a different swab each time. For a male patient, they're going to clean around the tip of their penis and then further down with a different swab each time. And in the book it says to tell your female patients to spread their labia and keep it spread until after the specimen has been collected, and then they can release it. For male patients who are uncircumcised, to have them retract the foreskin before they clean it, and then you initiate their stream and then pee in this and then stop, and then they can release their foreskin. So the procedure for a clean catch is to go ahead and open the container and tell them to initiate their stream, and then they can stick it under their stream after they've initiated it and peed for a little bit, and then they can release the cup before it overflows, and they can continue peeing as normal. Just explain to them, like I said, with the males and the females about the labia and the foreskin, as it says in the book, and that's about it. first thing I'm going to do is, after I've checked my orders and made sure this is what the doctor wants, I'm going to go ahead and gather my supplies and head into the room. So I'm going to have my little sterile catheter insertion tray, and I'm also going to have supplies to perform peri-care. So I'm going to go into the room. Hi, my name is Dusty. I'm going to be your student nurse today. Can I get your name and date of birth? Thank you. And do you have any allergies that I need to be aware of? Okay, wonderful. Well, I'm going to be, I'm here today to put a catheter in, an indwelling catheter into your bladder. It's a little tube, a little long tube that goes up into your bladder because you're having trouble either controlling your urine or having trouble urinating. There's several reasons why we want to do a catheter. We put catheters in before surgery a lot of times, so I'm going to explain why they need the catheter. I'm going to tell them how long we expect it to be in if we know. I'm going to explain to them that it goes up into your bladder and it has a little balloon that we stick it up there and we get it into your bladder and we inflate this balloon. That way it can't come out. So I'm going to explain to them that not to tug on it, not to pull on it, don't try to pull it out, it'll hurt. I'm going to explain to them, like I said, it's going to be a sterile procedure, and that I'm going to explain it might be a little uncomfortable going in, it might burn a little bit. And when it gets closer to time to doing the procedure, I'm going to go over a little bit of that again. But first what I'm going to do is I'm going to perform peri-care. So I'm going to wash you off, okay? And so I'm going to go ahead and raise the bed to working height. Slowly but surely. Okay, I'm going to go ahead and put them flat. And for a lot of female patients, what we can do is we can put them in Trendelenburg's position. So, okay, so now I've put the patient in a slight downward angle. So I'm going to go ahead and put some clean gloves on, and I have my peri-care stuff here. And this isn't sterile, I'm just washing them off. So I'm going to go ahead and give privacy, make sure I've got that curtain pulled. I'm going to go ahead and position the patient appropriately. I'm going to have checks pads underneath while I do this. So I'm going to position the patient appropriately. I'm going to go ahead and perform peri-care. So like soap and water and a washcloth. Go ahead and clean really good the labia and get a new one in the middle. You know, clean their anal area and clean everywhere and make sure they're good and clean. So after I do that, I'm going to go ahead and rinse it off and dry it off. And I'm going to perform privacy. I'm going to give them privacy again while I go ahead and change gloves, wash my hands off, perform hand hygiene. And then I'm going to prepare to go ahead and put that catheter in. So after I've done this and give them privacy, I'm going to go ahead and get my catheter stuff ready. So I'm probably going to have changed the checks pad and put a new checks pad underneath them, a new dry one, as I prepare for this. So if I had to leave the room, I would not have left the patient up in this weird position. I would have went ahead and lowered the bed and everything and gave them good privacy and everything. So, but in this case I had it with me, so I didn't have to leave the room. So I've got the catheter tray, and I'm going to explain to the patient again what I'm going to do. So I'm going to explain to the patient this is a sterile procedure. So I'm going to go ahead and get my table over here close to me.
So I'll make sure I don't let go or touch anything.
Okay. Alrighty, so this will be in its wrapper. It'll still be sterile. I'm going to go ahead and make sure the patient's ready, make sure they don't need to get up for any reason. I'm going to give the patient privacy. I'm going to go ahead and do another check, make sure this is what the doctor ordered on this patient. And I'm going to go ahead and prepare, after I've done all the peri-care, I'm going to go prepare to insert the catheter. So, I'm going to go ahead and have the patient assume the appropriate position, just like this. Okay. I'm going to go ahead and have a checks pad down. So now I'm going to go ahead and take this.
If it was the gentamicin medication, you would leave it for 2 hours. If it's just saline,
I have an inch leeway on this, so
maybe around.
you gotta be really careful when I touch it because I don't have sterile gloves on it. I've already performed hand hygiene before I've done this. Okay, so I'm gonna take my gloves. I'm gonna set them aside. I'm gonna take this first. the shiny side down. Make sure I don't touch the patient with this. Okay. So now I'm going to go ahead and put my sterile gloves on. I'm going to make sure I don't let this get out of eyesight. Okay. Okay, so now I've got my sterile gloves on. So now I cannot drop them below, waist height. So now I can go ahead and rearrange this since this is sterile and I'm wearing sterile gloves now. So I'm going to go ahead and take this and I can lay it down now. Shiny side down. And now I've got this and I can put it over the patient, shiny side down as well.
And have checked the order, I would clamp it.
Okay. So now if any of this touches the patient inappropriately to where I break the sterile fields, I have to start over. So now I'm going to go ahead and take this
And let it sit
and
for
set this aside. Okay.
30 minutes or so.
So the first thing I'm going to do is I'm going to go ahead and take my Betadine. This is actually the... Okay, so I've poured Betadine on these cotton balls, and this is something that I really need to think about. Is earlier whenever I asked the patient about their allergies, I would probably have asked them for sure if they're allergic to latex or Betadine, because those are pretty common allergies, and that's the big thing with the catheter insertion kit, is if they're allergic to it, then that would cause a problem. So after I put the Betadine on, I'd be careful to throw it away and not drop my hands. So I've done that. Now I'm going to go ahead and hook up the things that I need on my catheter. I'm going to go ahead and take this out of its plastic wrapper. I'm going to make sure I don't touch it on anything that's not sterile. And after I've taken this out of its plastic wrapper, I'm going to go ahead and stick it in the lubricant. Okay. So now I'm going to go ahead and clean the patient. At this point, both of my hands are sterile, but once I touch the patient with my left hand, it is no longer sterile. So I have to keep the patient, since it's a female, I have to keep the patient's labia open with my left hand after I've cleaned them, and I also can't take my left hand and use it for anything else. So here's my tweezers. I'm going to go ahead and get my Betadine covered cotton balls. I'm going to go ahead and break sterility with this hand. So I'm no longer sterile. So I'm going to go ahead and clean. And use each of these for one side, and then down the middle. Okay, after I'm done with that, I'm going to go ahead and just throw these away. That way I don't have to put them back in the sterile field. And so now I'm ready to go ahead and insert the catheter. So I'm keeping the labia apart, and now I'm going to get this out of the... There we go. Alright, I'm going to tell them to take a deep breath, and I'm going to go ahead and insert it. Make sure I don't touch my fingers with my right hand to their skin, because that would break sterility. So on a female patient, I'm going to go until I see a urine flashback, and I'm going to go an inch further. So if I'm in there and I've seen that I've gone an inch further than the flashback, I can go ahead and blow up this balloon and pull back. Make sure it's in there, gently pull back, and it is, so I can release. Now I'm done with sterile procedure, so I'm no longer sterile. And go ahead and unhook this, and I can go ahead and clean up all my supplies. Then I'm going to go ahead and remove my sterile gloves, and I'm going to put on new clean gloves. I'll throw those in the trash, of course. I'm going to go ahead and put on new clean gloves here while I finish cleaning up, and I'm going to go ahead and get, like, say there's excess of the lubricant, I'm going to wipe that off the patient. I'm going to go ahead and put on their little sticky thing on their leg to keep the catheter in there, and I'm going to ask them if they're feeling okay, make sure they aren't having any problems with anything. I'm going to take this here, and I'm going to hang it down here on the bed frame after I take this and make sure it's hanging good, make sure it's flowing well. And on this, kind of a fun fact is that if you've just inserted a catheter and you need a urine specimen, that's something that you can do out of the bag, but only if you've just inserted the catheter. So if say I've inserted the catheter and I have this hanging, I can go ahead and take this and take my sterile urine container. This part doesn't touch the inside of this because it is sterile. So this would technically be hanging down there, and I would just go ahead and open it up and let it flow. And then I would close it back after I've got my sterile sample. Put that back on, send that to the lab, put this back in here, and like I said, it's hanging down there, and make sure it's flowing well, and ask the patient if they're feeling okay after I've cleaned all this up, and if not, if they're feeling okay, then Okay, so now that I've got all this done, I'm going to go ahead and prepare to leave the room, but before I leave the room, I've got them all cleaned up. I'm going to go ahead and clean this up real quick. I've got this taped on, theoretically. I'm going to take all these away, I'm going to take all this away. I'm going to go ahead and put them back in a comfortable position. So take them out of this position here. Make it flat. And I'm going to lower the bed, make sure the side rails are up, and they won't be in this position. I'm going to go ahead and put this down, and put their legs down, of course, and then I'm going to cover them up. And like I said, that won't all be there. I will have cleaned it up. And then that's it. I'm going to go ahead and take my gloves off, perform hand hygiene, and let them know that if they need me, they can just push the call button. So now I'm going to demonstrate the insertion of an indwelling catheter on a male patient. The first thing I'm going to do, kind of make sure my orders are correct. Yes, the doctor wants this patient to get an indwelling catheter. And I'm going to check the French as well. I'm going to get an appropriate French catheter. They're usually 16 in the hospital, and they come in this little kit. So for an adult, I'm going to get a 16 French catheter. I'm going to check whenever I'm opening it. Something I'm going to check is what on the catheter, the balloon, how much I want to insert of the water, sterile saline, normal saline into the balloon. So those are things I'm going to check later. So I'm going to go ahead and get my catheter kit. I'm going to go ahead and get some stuff to perform hairy care, like a basin of water, washcloths, that sort of thing. I'm going to go ahead and head into the room. So, hi, my name's Dusty. I'm going to be your student nurse today. Can I get your name and date of birth? Thank you. And do you have any allergies that I need to be aware of? No? You're not allergic to latex or to betadine, correct? Correct. Okay, good. So what I'm here to do today is I'm going to be inserting an indwelling catheter. So what that is like a tube that goes in through your urethra, the hole where you pee. It's going to go through that hole, and it's going to go up into your bladder. And it's got a little balloon at the end of it. It's real small. Once it gets into your bladder, I'm going to put some liquid into that balloon, and it's going to make it about the size of a quarter. That way you don't want to pull it out, okay? It's going to go up in there, and you don't want to pull it out. That stays in there, okay? So I'm going to explain to them how long the doctor wants it in there, for what reason the doctor wants him to have a urinary catheter. So potentially the patient is incontinent, potentially they're going into surgery, they're having trouble initiating urination, that type of thing. So I'm going to explain to the patient why they are receiving this catheter. And I'm going to ask them if they have any questions, and if not, I'm going to go ahead and start by performing pericare. So I'm going to go ahead and perform my hand hygiene and get my gloves on. I'm going to give them privacy, so I'm going to pull the curtain, close the door, that sort of thing. So I'm going to fill my basin up with water and soap. I'm going to get my washcloths. I'm going to go ahead and lay the patient flat. And raise the bed to waist height. Since the urinary catheterization is going to be a sterile procedure, it has to be above my waist. That way I'm not dropping my hands below my waist and breaking sterility. privacy and everything, I've got my water prepared. I'm going to go ahead and perform pericare on this patient. So make sure I have a checks pad underneath while I wash off their urethra, wash off around their penis, get a new washcloth, wash underneath, wash everywhere, suprapubic area, wash their anal area, make sure they're good and clean. Then I'm going to go ahead and rinse them and dry them. I'm going to go ahead and change the checks pad at this time, get a new checks pad, dry one. I'm going to go ahead and take my gloves off after I've done all that and cleaned up all my supplies. I take my gloves off, perform hand hygiene, and go ahead and prepare to do the catheter. So I already have this in the room, so I'm going to prepare to go ahead and do that. So I'm going to go ahead and make sure I have privacy. I'm going to go and position the patient appropriately. Okay, and for a male patient, you want them just totally flat. You don't need to do the slightly Trendelenburg position that we did for the female. So I'm going to go ahead and make sure their legs are spread out pretty good. So I have room to put my catheter kit. Okay. Alrighty. Go ahead and get my catheter kit. Okay, so it'll be in the wrapper. It'll still be sterile. I have an inch border around it. Okay, and so I've got my table real close to me. That way I can put my gloves there. And I won't have touched that. I touched that just now, and that's not okay. I'm going to make sure I grab this by the edges. I'm not touching or breaking sterility. So on this, I'm going to go ahead and grab it by the edges, that 1 inch border I have. Shiny side down. Okay. Now I'm going to go ahead and put on my sterile gloves, making sure this is still in eyesight. Okay. Dominant hand first. Okay. So now I'm sterile. So at this point I can go ahead and arrange this. Since I am sterile, I can go ahead and fix that. And I can go ahead and get the next pad. Shiny side down. So now I'm going to get this. Alright, so now what I'm going to go ahead and do is I'm going to go ahead and separate this. I'm going to put this in front. Okay, now I'm going to go ahead and prepare the catheter. So this will be in a plastic, this part being a plastic little cover. So I'm going to go ahead and take that cover off, making sure I don't fling this anywhere to break sterility. So I've got that, and I've got this plastic cover that I'm going to throw away. And now I'm going to go ahead and get my lubricant out. And stick this in the lubricant. Then I'm going to go ahead and get this little syringe here, take the cap off, and go ahead and hook that up as well. Okay, so that's ready for whenever I need it. So now I'm going to need this hydrogen peroxide, so I'm going to throw it away. I've got my betadine, and I know the patient's not allergic to it. I've already asked, so I'm going to go ahead and pour the betadine on these cotton balls. Okay, throw it away. So now I'm ready to start my pericare. So I've got my tweezers. At this point, I'm going to break sterility with my left hand while I grab the penis. So after I've grabbed the penis, that's it for the penis. I can't use that left hand. So I'm going to go ahead and take the cotton balls. I'm going to clean the urethra. Really good. New cotton ball, clean around. I'm going to make sure I don't want to touch whenever I pull this back, I can't touch my gloves to anything on my scrubs. I can't touch anything or that'll break sterility as well. So. Okay, so these are done too, so I can go ahead and toss them. Alright, so now it's time to insert the catheter. So I'm going to go ahead and remove this, throw it in the trash. I can move this closer to the patient, that way I'm not dragging it across the sterile field. I'm going to go ahead and take my catheter out of the lubricant. Okay. So now I'm going to go ahead and start inserting the catheter. I'm going to tell the patient it's going to burn a little bit. Just have them take a deep breath and breathe normally and don't bear down or anything like that. I'm just going to go ahead and insert it. So ready? And I'm going to go. Make sure I don't touch the penis with my right hand. I'm going to go like 8 inches or so until I see urine flashback. And then I'm going to go ahead and remove my hand from the penis. I'm going to grab it and stabilize it, and then I'm going to go ahead and inflate the balloon. If I feel resistance, I'm going to stop. I'm not going to keep going if I feel resistance. So after I've inflated the balloon, I'm going to go ahead and pull back, make sure it's in there, and it is, so I can unhook the balloon, and now I'm no longer sterile. So I'm going to go ahead and remove my sterile gloves. So I'm removing my sterile gloves, and I'm going to go ahead and throw them away. And so now I'm going to put on my clean gloves. The thing I'm going to do right now is I'm going to go ahead and tape the patient's catheter to their leg. So if they're not ambulatory, the inside of the leg is good, or if they are going to be ambulating, on top is better. So I'm going to go ahead and do that. Like I verbalized in my other video, I can get a sterile specimen out of the bag at this point. Since it has just been inserted, I get a sterile specimen. So if I need to do that, that's something I'll do. I'll go ahead and after I've taped this, I'm going to hook this to the bed frame. I'm going to go ahead and rip this off. I'm going to go ahead and take all of this and throw it away. Take all of my supplies off of the patient. This I can't get off right now, but I would rip it off theoretically. I'm going to clean up, throw away, get the patient comfortable again. Go ahead and put their gown down, provide privacy, tell them if they have any problems. Something that I want to look for with this catheter, I'm going to make sure it's draining. You know, I don't want to leave it there and it not be draining. So whenever it's draining, I'm going to go ahead and be ready to leave the room. I'm going to put their covers back on, tell them if they need anything, just push the call light, make sure it's within reach. And I'm going to go ahead and lower the bed.
I'm out here. There's your call light. See you later.
Make them comfortable, make sure that they have their side rails up here. Make them comfortable, make sure if they want to be stood up or anything, I can do that at this time before I leave. So.
Okay. Yeah.
Well, Mr. Campbell, do you have any questions for me? Are you doing okay? Do you need anything? If they say no, I'm going to go ahead and take my gloves off from Heat Hygiene. Tell them I'll be back soon to check on them. So after I tell them that I'm going to come back and check on them soon, I'm going to go and after every catheter insertion, I'm going to document, you know, the French, how much liquid I use to insert the balloon, to inflate the balloon. I'm going to document the insertion, document if there's any complications, that kind of thing. And after I've done all my documentation, then I am good to go.